Morning, everybody. Nice to see everybody this morning. So today I'm going to talk about a bit of Black Cap's work over the past about 18 months in developing you can go to the next slide after that, developing a resource for African Caribbean Black gay men around their health, right? Really a resource to address health and wellness needs, and also better engage Black gay men, Black BMSM in health and HIV issues, right? And these are guys in Toronto. Again, we want to raise awareness about current trends in health issues impacting the sexual health, HIV, and overall health. And we're really focusing on health here because I think often as Black gay men, our health is often defined as either the absence or presence of HIV. And often that's where the work of agencies, in a lot of cases like agencies like Black Cap, it often stops there. And I think as a sector, we're perhaps more and more recognizing that it goes beyond HIV. It's about mental health and emotional health and spiritual health and physical health, all other spheres of health. And so we've been in this process to design this resource, I should say, over the past number of months. Yeah. So how do we get there? About actually this time last year, we started a process to launch focus groups and online surveys. So I think it was about May, June last year, we delivered 5 focus groups to guys, Black gay men, over 29 and under 29 as well. I think we actually had about 40 to 50 guys in the focus groups. Again, we wanted to collect data about their experience as Black MSM in Toronto, and then we launched surveys in the summer of 2015. I think that was about June, July period, and we actually had about 142 responses, which for us was really good. I don't know that we've ever collected this much data from Black gay men in Toronto before, and we actually found the findings to be quite illuminating in terms of how we're going to work with these guys and how we can design resources for these guys as well. Yeah. So a little bit about the focus group findings. As I said, we did focus groups with about 40 to 50 Black gay men, and we really wanted to explore these 5 spheres of health. Again, kind of looking at physical health and sexual health, emotional health, spiritual health, and mental health. Kind of trying to get a sense of, are these important spheres of your health? Is this in fact how you actually define your health? And if we were to look at these spheres of health, perhaps which of these are most important? And where should an organization like Black Cap or APA, where should we, as we're designing our interventions, where should we place these spheres of health in terms of priority for you? Yeah. What was really interesting is that sexual health was actually bottom of the list for a lot of guys, which is both a surprise and not a surprise. When we asked them to rank in the focus groups, they consistently said my spiritual health, my emotional health, my physical health, and my mental health are actually much more of a day-to-day priority for me than my sexual health, yeah? Which is a little bit antithetical to the way that we as a sector perhaps think, right? So this is a good lesson for us. Spiritual health among this population, we actually found to be, again, a very important issue, something that this sector often, I think, other than perhaps APA, who really does a good work around spiritual health, a lot of us kind of say, and me as well, I'm an atheist, and I'm a very strident atheist, and I don't like to go there, but this is a really good, Lena, don't laugh at me. Yeah. We've got this thing that's gone on for years, and that's okay. But as a sector, it's, again, a good lesson that, we've got to think of all these spheres, and spiritual health is really strongly and clearly connected to someone's sexual health, right? Just as we would kind of talk about a social determinants of health framework, we're not talking about spirituality a lot. And a lot of our guys actually define spirituality in very different ways. For some, it was just meditation. Who was talking about meditation? Tao was talking about meditation earlier on. For some, it's a very strident faith in terms of their Christianity, et cetera, et cetera. As I said, sexual health was ranked as least important. And and we also asked guys to help us perhaps define what sexual health meant for them. And they talked about regular sex as being important, the consistency of safer sex practices being important, and having more sexually balanced relationships in terms of things like power, in terms of things like consent and decision-making, the absence of, the importance of power. So those were our focus group findings. And then we look at our online survey findings. As I said, we surveyed about 142 guys over the summer last year. And of course, given that we had found that sexual health was ranked at the bottom, we actually wanted to explore that a little bit in the survey that we did over the summer, right? And what we really found, and perhaps surprisingly and not surprisingly, is that, Black gay men really have a really pretty sound understanding about what health means to them, right? There's clearly a sense of capacity there. There's clearly a sense, I think, of commitment to health there, which often doesn't match some of the dialogue, some of the conversation that we hear about Black gay men and their health, and about Black men in general and their health, by the way. We asked them in the survey what was their most important and least important. We've got a slide that talks about that next. And mental health came out as number one in the survey. So of our 142 guys that were surveyed, mental health is very, very important in terms of things like emotional stability and depression and anxiety, those kinds of things, yeah? We found that guys, as they're trying to access information about their health, really want to look at the internet. They don't necessarily want a service provider in their face. They don't want another pamphlet or a brochure. They don't necessarily need another structured intervention in terms of their general health. It's like, let me go online and manage this information by myself. Let me access it on my own terms and in my own way, and I'll do that, thank you very much, without you. Yeah. We found that guys want to access services in their home community. When we looked at the postal codes of our guys who completed this survey, many of them are not living downtown. Many of them are not down in the M4 postal code. Many of them are kind of distributed across the north of the city. And by far, their preference was to engage in services related to their health in their own community. So coming downtown is not always the best option for guys. And again, we should not be super surprised by that. But again, as a sector, look where we are. We're downtown. We're in the downtown core. So another lesson learned for us. We actually found that newcomer HIV positive men who completed the survey are pretty well engaged in their care. Again, that kind of goes against some of what we think about and what we hear about gay men who are living with HIV. But it also kind of matches well some of the data that comes out from the OCS about ACB people who are living with HIV and being relatively well engaged in their care. But we also found that HIV negative BMSM are not using good health care in terms of often accessing emergency rooms, going to clinics. So in terms of their primary health care, things are not quite where they could be, right? And a lot of guys, and this is, I think, good for organizations like Black Cap and APA, really kind of thought about ACB ASOs as health hubs for them, right? I can go to this one place, I can get all the information I need about my health, and I can access information and kind of on my own terms, right? And then, let me just say, there was one thing I wanted to say here. Yeah, so this distinction about what's important and what's concerning. So we found that, again, for most Black gay men, what was most important to them was their mental health, right? So I need services, I need to have access to information, I need to not sit on a waiting list for a year to get to a counselor. Those kinds of things. And we kind of tried to make this distinction between what's important and what's concerning, right? My mental health is important, but really day to day, perhaps what is most concerning to me is around sexual health. And we found that that was mostly related to HIV and STIs, which is really an important distinction as we're designing this resource for Black gay men. So we'll just go to this one. And this just shows a ranking of those spheres of health that I talked about. And we just have the 4 here, physical, mental, emotional, and sexual. And there's actually a typo on here. It should be importance 1 being the least important and 4 being the most important. And we can see sexual health sits between 1 and 2. And mental health is there, and it's above 3. Yeah. So when we looked at all the final data, we wanted to get a sense of what are the strengths that exist in our sector and among Black gay men in terms of their sexual health. And then we also wanted to look at some of the challenges. So in terms of strengths, it's I think, relatively clear that BMSM are feeling heard in the spaces that they're accessing services in, and these are primarily ACB ASOs and other ASOs, by the way. And that organizations such as ours and health centers are doing their jobs in terms of supporting access to health care. We also found that BMSM are really responding pretty well to messages about HIV testing. Most having tested, almost all of them having like 90% plus have tested at least once, but a good number of those guys are regular and frequent testers, which is really great. And as I said earlier, those that are living with HIV are largely, for the most part, accessing care related to their HIV, which is really good. And only about 1 in 4, I guess this is a strength but also a challenge, is that 25% have received mental health support, and a significant amount are able to identify that their mental health is of importance to them. So a strengths. Often, we find that there are lots more challenges than strengths when we're dealing with a population such as this. So we find that ACB, MSM are, again, to no surprise, are dealing with issues of race and immigration status. The population that we work with at Black Cap, and the same thing at APA, largely a newcomer population, guys that are very new to Canada, and that brings with it its own vulnerabilities. But also as new Black Canadians, they're really experiencing racism in many cases, for the first time in their lives in a very unique way. And of that, of course, is linked to sexual health and risk for HIV. Yeah. Many receive social services care from LGBTQ and racialized people or friendly providers, but much of their health care is received from outside of these community groups. So again, they're accessing health care, often not from folks that look like them, which is a real challenge. Again, because there's often that not understanding of what it means to be a Black man in Canada, what it means to be a Black newcomer in Canada, and what it means to be a Black gay man in Canada. And these are important contextual factors when we're talking about health. As I said, anti-immigrant and anti-Black discrimination among service providers was also raised as an issue among this population. So folks that work in our sector and in other healthcare sectors are really creating barriers for this population, which is obviously a huge challenge. There's also this piece around service provider versus the agendas of Black gay men. And again, I think as a sector, we're often saying this is what's most important to you in terms of HIV and your risk for HIV. We found there's some tension there, and that tension needs to be talked about. In terms of increased access to broader health care, guys talked about, again, their interest in using the internet, but also a need for more flexible healthcare services, right? Clinic hours are set, services might not be available in their local neighborhood, the list goes on. So it's the important kind of contextual factor around broader access. And finally, supporting BMSM to commit to their sexual health, and the importance of really working with service providers, not necessarily with BMSM, to share effective interventions in engaging Black gay men in their sexual health and their risk for HIV. So those are some of our high-level findings. Just want to end by saying thanks a lot to GMSH, who actually funded this project and provided Black Cap with resources to make it move forward. Thanks to APA and ACHO as well for being partners in this project. David Lewis, who a lot of you know, was our consultant. Perhaps most importantly, the guys that attended our focus groups and did the surveys, and also to Lance McCready and David Brennan. And just in terms of next steps for this project, so we've done all this data gathering over the past year. We're actually right now in the middle of developing our web content and shooting photography for our website, and we're hoping it will be up by Pride weekend. So we've got a dissemination plan and a communications plan associated with the website, and our goal is, again, to get some of these issues out to Black gay men in our community and get them engaged in their health in new and effective ways. And I'll end there. Thank you very much.